Hey guys, Dr. A here, and I'm standing here in the Biomechanics lab on the campus of Point Loma Nazarene University in beautiful San Diego. This lab is equipped with a state-of-the-art motion capture system, marker-based motion capture system, with 8 cameras situated around the room. It also has 2 force platforms by AMTI that are embedded on the ground here right behind me, and those measure ground reaction force data in 3 dimensions. So if someone's walking, running, jumping, making a cut, we can measure both kinematic and kinetic data while they're performing those movements. We also have electromyography. This is EMG, an EMG system that measures muscle activation during those specific human movement, or any human movement if you can think of, and then we can tie or sync the muscle activation patterns with their kinematic and kinetic data. All of those combined gives us a biomechanical profile of each human movement task and gives us a dynamic assessment of what that individual or patient can do. So this video introduces you to the world of biomechanics. So hopefully you can understand and get a better feel of the science. Let's dive right in.
So I want to talk a little bit about what is biomechanics and why it's important. Even though the term biomechanics didn't exist until the late 20th century, there are reports of the science being practiced in different forms and fashions. In fact, between 30 and 15 BC, a Roman engineer by the name of Vitruvius came up with a building guide known as De Architectura, and it dealt mainly with architecture, but it also explored the human body. In fact, his guide served as a foundation on which Leonardo da Vinci's Vitruvian Man was based. Oops, sorry about that. Got to keep it PG-13. And he described the human body as a geometry of perfect proportions. Now, I don't want to go into detail with the Vitruvian Man. I'm sure many of you recognize this piece of art and piece of science. Leonardo da Vinci was intrigued and very interested in anatomy and applied anatomy. However, it is a form of biomechanical application. More specifically, it's a form of kinematic and anthropometric application. But it wasn't until the 70s where the term biomechanics became a recognized specialty of science, and it was defined as the study of the movement of living things or the structure and function of living things using the science of mechanics. And if we look at that word biomechanics, bio means living system, plant, your dog, or if you're taking any of my courses, we're dealing mainly with the human body, whereas mechanics deals with the branch of physics that specifically focus on the forces and energy that change or cause or change the motion of a body. And mechanics there are actually 2 disciplines within the science of mechanics. One is statics, and that deals with systems that are in a state of equilibrium, that are at rest or at a constant state of motion. And the other one is dynamics. This is the study of systems that are accelerating or in a changing state of motion. So we apply those 2, statics and dynamics, to understand how the human body moves. And in Dwayne Newson's Fundamentals of Biomechanics book, he eloquently describes biomechanics as providing conceptual and mathematical tools that are necessary for understanding how living things move and how kinesiology professionals might improve movement or make movement safer. You are a kinesiology major or you are a kinesiology professional, so I guarantee you, if you're not already, you're going to be practicing some form of biomechanical analysis to understand how your patients or how your athletes move, and more importantly, how to get them to move more efficiently. So, as I mentioned earlier, we apply these basic principles of mechanics to understand how the human body moves within the context of gravity and muscle contractions and frictions. These are the forces that cause or change the movement that we see. And let's just take, for example, we're looking at a toddler who's first learning how to walk. And we're just looking at this toddler. You can see that his arms are are elevated or slightly abducted, and we know this because he's trying to maintain dynamic stability, trying to maintain his balance. He doesn't have as much knee flexion, especially in the early stance. Lacks what's called a heel rocker, which is the passive plantar flexion during gait. I talk about gait analysis in another lecture, but what I just gave you is kind of a litany of kinematic and kinetic patterns that we see in this case during walking. And really that is the application of mechanics, the application of static dynamics, and in this case looking at human movement, that give us an explanation of what's known as the kinetics and kinematics of human movement, which is two perspectives. Gives us two perspectives. Kinematics gives us two perspectives by which we conduct these biomechanical analysis. Kinematics deals with the spatial and temporal characteristics of human motion without regard to the forces and torques that cause or change that motion. Spatial and temporal just means the dimensions of space and time. These are terms such as displacement, velocity, acceleration, or angular acceleration, angular velocity, angular displacement. So in subsequent lectures, I talk a lot about kinematics of human motion and joint motion. Kinetics deals with the forces and torques that inhibit, cause, or modify the motion of a body or the motion of a joint. So I'll use these quite a bit throughout the coursework. In fact, if you look at the research and look at some of the practices in biomechanical analysis, you'll hear and see these terms quite a bit: kinetics and kinematics. Okay, so how does this all come together? As I mentioned earlier, the bio part in biomechanics, that's the biology of the human body. This includes the neuromuscular system, the skeletal system, which essentially facilitates human movement. And how do we quantify and explain the interaction between forces and the motion that we see? We use mechanics. We use the mechanical principles of statics and dynamics that provide the kinetic and kinematic explanations as to why this human body occurs. The movement of the human body occurs. So you're in a career path, or if not already, in kinesiology. So you're interested in studying human movement, obviously, and applied anatomy. And so I often get asked, what exactly is the difference between biomechanics and kinesiology? And I could completely understand why those two terms can be conflated, because biomechanics, I just told you that biomechanics deals with the structure and function, the study of structure and function of living systems and the motion of the living system using basic principles of mechanics. Well, biomechanics is a subdiscipline of kinesiology. If you think of kinesiology as a scholarly study of human movement, and biomechanics is simply one of the many academic subdisciplines of kinesiology. So in biomechanics, we apply the principles of physics. We use math, linear algebra, depending on what level in which you're taking this biomechanics course. You will have an opportunity to apply these principles to understand joint motion and whole body motion. But biomechanics, as I mentioned earlier, is a study of human movement using these principles of mechanics. So why is it important? Why study biomechanics? Well, one, it gives us an objective evaluation of human function. Like I said, if you're a kinesiology professional, your goal, your ultimate objective in your career or your profession is to understand, describe, and hopefully improve the efficiency of human movement. And we use biomechanics in order to provide that analysis. This specifically can be used to identify causes of injury or find ways to reduce the risk of injury or treat certain injuries. It can be used to analyze and enhance athletic performance. Biomechanics can be used to evaluate and form new corrective exercise techniques and other rehabilitation techniques for injured players or patients with certain neuromuscular diseases. Help guide coaches in terms of their specific sports in guiding these athletes, making them better athletes, right? If you're interested in occupational therapy, biomechanics, so there is an occupational biomechanist, or a subfield known as occupational biomechanics that deal mainly with ergonomics, right? So you can certainly get a career as a biomechanist. That I have a few students over the years who have been fortunate enough to basically have a career as a sports biomechanist, or as a biomechanist at the Navy, or at a gait analysis lab, or for a Major League Baseball organization. But whether you become a PT, an athletic trainer, or an athlete, working in sports medicine in some fashion, a coach, a PE teacher, a parent, I guarantee you will apply some form of biomechanical analysis to understand the way your patients and the way your athletes move. Now, in this next video, it's just a short video, and I think it does a great job of describing kind of the science of biomechanics and why it's important. This is by the DeLuca Foundation, so check it out.
What is biomechanics? It's the story of us, how we move through the world, forward, backward, up and down, under and over. It's a story about technology, science, music, medicine, sports, and art. It's written in equations, steps, rotations, collisions, code, and sweat. It's full of setbacks and successes. Biomechanics is a story built on the past, informed by the present, and envisioning our future for a better world in motion. We tell this story so that no matter how we move, we're always moving forward.
So cool. You want to be a biomechanist now? Well, stick around. Throughout the coursework, I bring up examples of how real-life biomechanists are working out in the field or in practice at a professional level. So some really cool stuff. Can't wait to show this to you. As I mentioned throughout this video, biomechanics is all about movement, and we can't talk about movement without discussing the mechanisms by which we move, and this includes talking about exercise physiology as well as motor control and learning. So these are subdisciplines of kinesiology that deal with the mechanisms by which our muscles contract and subsequently control and cause the motion that we see. In fact, there are other subdisciplines in kinesiology that's related with biomechanics in order to determine and provide a complete picture of human movement, or how human movement occurs. So here is my poor attempt at a Venn diagram, and you can see that biomechanics fits in here with exercise physiology, motor control and learning, pedagogy, and some of the psychosocial aspects of human movement. So all of those subdisciplines of kinesiology give us a complete picture of human movement. So this is the same graph I showed you earlier. This is biomechanics. The biology relates to the neuromuscular and skeletal system and how they control output that are determined by the muscles. The muscles themselves, how we measure the physics, is using the mechanics, as I mentioned, the statics and dynamic aspects that give us kinematics and kinetics as a result of the muscular contraction. And exercise phys gives us those mechanisms, right? It gives us the energy mechanisms that provide the fuel for these muscle contractions. So all of these together, I'm not going to go into these in full detail, but you can begin to understand the relationships of different professions that ultimately deal with the biomechanics, the exercise physiology, the motor control aspects of human movement, and how that all comes together when we're dealing with a patient or athlete that has a certain movement disorder or a certain condition that requires an improvement, right, to make them more biomechanically efficient. So speaking of efficiency, more specifically biomechanical efficiency, we're really talking about two main things. These are two main goals that we have when we're using biomechanics. One is to improve performance or improve athletic performance, and another one is to reduce the risk of injury, what we call risk mitigation. So those two things actually go hand in hand. I mean, you can't have an athlete who has a higher risk of injury and expect them to perform at their optimal level. So there is a balancing act, and I'll cover a number of different cases throughout this coursework that deal with that balancing act and be able to maximize their performance while minimizing their risk of an injury. So that is related. That actually defines biomechanical efficiency. So let's take a look at one example. Let's take a soccer player here. And as you probably know, if you follow soccer or played soccer, a number of soccer players, especially female soccer players, are predisposed to knee injuries. And so one question that we can ask from a kinematic perspective, this is a simple one, is how fast was a soccer player moving at the moment of injury? That is a kinematic question because it deals with, in this case, the speed or velocity of the soccer player. Another question that's related to kinematics would be what was the knee flexion angle when she made that cut? I remember one of my first experiences as an athletic trainer for UCSD baseball is I was following this player, and she was rounding first base. She was moving fast. I know that her foot basically landed on the base while her entire body was trying to get to second base. Unfortunately, that twist, that amount of pelvic and trunk rotation, created enough rotational torque that she eventually, what we found out is she had what was called an unhappy triad, which is ACL, MCL, and meniscus, and she tore all of them, unfortunately. So I just gave you an example of a kinetic question because I mentioned torque, rotational torque. So a question from a kinetic perspective has anything to do with force or torque. So for example, how much force was absorbed by the body when making a quick change in direction? So those are examples of kinematic and kinetic perspective questions here. And in soccer, and not just in soccer, but if we're dealing with the gamut of knee injuries throughout sports, we're dealing with soccer, basketball, volleyball, looking at cutting maneuvers and landing maneuvers, and more specifically looking at the kinematic and kinetic patterns of these maneuvers. So some really cool stuff in that regard. Lots of good research, and hope to cover a lot of that research throughout the coursework here. Other examples include equipment, looking at design equipment and how well they match up to the biomechanics of, say, for example, the knee or the ankle or the shoulder. With amputees, they're looking at the effects of prosthetics. These are prosthetics that are designed for transfemoral and transtibial amputees that allow them to not only walk, but be able to run and compete in a 5K or full marathon, for example. So amputee biomechanics is certainly a huge discipline within the world of biomechanics. Taking a look at balance and stability here, we can use biomechanics to understand the role that muscle contraction and joint positions have in maintaining or improving dynamic stability. Looking at ergonomics, doesn't take a seasoned or experienced biomechanist to tell that this person or this position on the left is a bad position that's going to predispose this person to an injury to the lower back, for example. So proper biomechanics would be this position on the right. So we can use the methods of kinematic and kinetic principles to understand why these position is bad and good, respectively, on the left and right. If you're a physical therapist or planning to be a PT or PT aide, You will use biomechanics to understand how patients rehabilitate or are affected by, let's say, a spinal cord injury or a knee injury, an ankle injury, or recovering from surgery. They're trying to get them to pre-injury levels, so trying to get them to walk normally or to run normally. So we use these biomechanical techniques to understand the kinetics associated, or the factors that ultimately determine how well they walk, run, and overall move. So an area that is dear to me and that I have a lot of interest in, I've been doing this research, biomechanical research, for a number of years, probably over, I would say 12 years now, is in baseball. And so I'm mainly interested in pitching related injuries. If you follow baseball, you'll know that pitching related injuries at the shoulder and elbow remain prevalent throughout all levels of baseball. So there's certainly a lot of interest in that. And biomechanics plays a huge role. And we're very fortunate enough to have a number of different state-of-the-art equipment that allows us to measure the kinematics and kinetics of a baseball pitch, both in the lab as well as outdoors, as I showed you here. This is actually our bullpen on the campus of Point Loma. And you can see that the cameras are all situated around the mound. Oops, I didn't want to do that. Oh, there it is. Here. And these are motion capture cameras, and that allows us to view the player in all three dimensions and understand what's going on here. And that gives us a spatial model that looks something like this. And this particular model, I built it in what's called Visual 3D, and I highlighted what's known as mechanical energy to show the flow of mechanical energy from the legs to the pelvis, to the trunk, and ultimately to the throwing arm, and how that interacts with both ball velocity and the joint kinetics at the shoulder and elbow. So some great research there that I'm going to be sharing with you throughout this coursework. We've been very fortunate to collaborate with a number of different organizations and teams throughout the country, and perhaps even more so because now that we have former students of mine who are working full-time for these organizations as a biomechanist. So a lot of the research they've been doing, they're continuing at their respective organizations. So I'm really excited about that. This is a relatively young field as compared to some other areas of biomechanics, especially with the advent of state-of-the-art equipment such as markerless and wearable sensors. So some pretty exciting stuff that's happening in baseball today. So I'm going to leave with this note. This is a video from the Nike Sports Research Lab in Beaverton, Oregon. They have a really cool lab. In fact, they have a brand new lab now that I believe just opened up this year, 2020. Or maybe last year or late 2019. Anyway, they've got a number of state-of-the-art biomechanics equipment that they use in conjunction with their other equipment to understand the effects of their footwear, their apparel has on athletic performance. So some really cool stuff. So check this out.
If you take science and design by themselves, they have no power. They're not going to do beautiful things, but the overlap and the convergence of those two together is when beautiful things happen. It's an extremely creative process to be a researcher in the Nike Sport Research Lab. If you look at all of us, we're all extremely passionate about sport. We geek out on the science of athletes and athletic performance. Every day is a new challenge, and we want to make athletes better all the time. Athletes ask us for three things. They ask us to make me better, to protect me, and to inform me. The better you understand the needs of that athlete, the better you're going to make product. Motion capture is one of the tools we use. What it allows us to do is really objectively understand an athlete in motion. We use high-speed video. Most digital cameras capture around 30 frames a second. We can do 30,000 frames a second, so we can see things you don't necessarily see with the naked eye. Our force plates take thousands of measurements per second, and we get forces in three-dimensional space. We have environmental chambers. We can collect things like expired gases, so we know the amount of energy your body is using to do a particular movement. And in these chambers, we can accurately replicate weather from anywhere on the planet and make sure that our product is going to work in those environments. How Hal is our copper sweaty mannequin. And what Hal allows us to do is understand the thermal or evaporative properties of the garments, and we can very quickly turn over prototypes and have a deep appreciation for how they're going to perform on an athlete later. When we look at the data we capture, there's beauty in that. I've heard people talk about the data that we look at, the lines and curves, like a symphony.
So much in the same way that someone who reads music can actually hear the sounds and instruments being played, sometimes we can see the movement of what's actually occurring. Data is really the new voice of the athlete, and by listening to that voice, we can challenge the current paradigms to do something previously unimagined, to change the game and to change the way that athletes perform. We take the knowledge that we get from working with these amazing elite athletes and turn those insights into the unbelievable products that we make here at Nike. To see these products used on the field of play to help make athletes better, that's what fuels our passion. That's the power and the beauty of what we do. And Nike does it better than anybody else.